Just outside a Rohingya refugee camp in Cox's Bazar, Bangladesh, an isolation center is built for COVID-19 patients. Aid agencies are increasing medical care resources for the 860,000 ethnic Rohingya living in the overcrowded camps and almost 450,000 Bangladeshis living nearby.
We have a situation in the camps that is really ideal for coronavirus transmission. As I said, we have cramped conditions. People are living really on top of each other. There's a lack of hygiene.
In the past few months, 5 new isolation and treatment centers have opened with more planned. Aid groups hope to have more than 1,100 beds available by July, but given how easily COVID-19 spreads, that may not be enough.
There is a great concern about potentially not being able to have sufficient capacity for all the cases that we may see.
Clean water and soap supplies have been increased across the camps. But refugees use communal water pumps and toilets. That increases their chances of getting infected.
If you want to have water at home to wash your hands with, you're taking a jerry can and you're going to a communal pump and you're filling it. Has that communal pump been used by someone that themselves coughed on their hand and then pumped on it?
A global shortage of medical-grade personal protective equipment, or PPE, for doctors, nurses, and other healthcare workers could eventually lead to the closure of COVID-19 treatment centers in and near the camps.
If we don't have sufficient PPE to make sure that we can give them the safest possible working environment, then we simply cannot operate.
VOA shot this video in a Doctors Without Borders hospital last year, well before this COVID-19 crisis started. Refugees praised the care they received. But aid groups say if the coronavirus spreads quickly, they may be forced to make life and death decisions in ration care because of limited resources.
I definitely imagine that doctors will have to make choices about patients who may not survive even with the best care, and to give that care to patients with a better chance of survival. We all hope to avoid those decisions.
Despite the obstacles, aid groups say they're committed to doing all they can for their patients. For VOA News, Dave Grunebaum, Kuala Lumpur, Malaysia.